Dr. Daniel Knowles from Network Family Wellness Center, here to discuss a living well tip on blood pressure. A major concern in U.S. healthcare is that of blood pressure. And we are most commonly told to take medications. Medications will only mask the problem. And you're on medications for the rest of your life. Some of them can be very bad, like the drugs used to lower blood pressure. Among the top 10 drugs prescribed in the U.S., blood pressure or hypertension medications ensnare millions into the prescription drug arena. And this trap can kill 200,000 people, injures close to 2.2 million Americans a year. Now, I'm not telling people to go and get off their medications, but I want them to have solutions to take care of their bodies in the first place. And really, this comes down to money, because understand, blood pressure medications are a big business in the United States, and the medical community as a whole want people to take medications. And often when I talk about this topic, because sometimes I feel like I'm Robin Hood, robbing from the rich to feed the poor, because that's really what's going on in the American economy. You have statin drugs, $8.4 billion on Lipitor, $4 billion on Zocor, $1.7 billion on Provocol, $830 million Lovastatin, and Crestor, Lovastatin $262 million. This is big business in the United States of America. And so what I want people to do is not be on these medications for the rest of their life, but I want them to be able to take care of their body in the first place, or if they're on those medications, know what steps they have to do to get off them. Understand, this is so significant now that what they're telling people is if you have a risk of hypertension, you might have hypertension. Take the medications now because they will slow the process of you getting hypertension later. So it's like you don't even have the condition, take them anyway as a preventative notion or preventative measure. And I'll tell you, one of the crazy things relative to statins in this area is Life Extension magazine said that when people take statins, they actually take out the CoQ10, which is important for heart muscle. CoQ10 helps your heart muscle. It lowers cholesterol, and if you take statins and it takes the CoQ10 out, then it weakens your heart muscles, and you actually wear out your heart more easily or earlier. So first thing relative to lower blood pressure I want to talk about is chiropractic. There have been multiple studies relative to chiropractic care and lowering blood pressure. University of Chicago Medical Center, they examined 50 people that were suffering with high blood pressure, gave them one chiropractic adjustment, and they had, from one chiropractic adjustment, these 50 people, reduction in blood pressure that was equivalent to taking 2 different blood pressure medications simultaneously. That's huge. Any of us would rather, myself included, be able to do something that's innocuous, like an adjustment, rather than put a medication in our body if it can have the effect of 2 medications. I know myself, one of the first patient I ever took care of when I was in school at Sherman College, I was adjusting them for spinal subluxations with the intention to get their spine healthier. No intention whatsoever to do some kind of adjustment to affect the blood pressure, but the woman was a nurse and she had been on blood pressure medications for 20 years. Meanwhile, I realized I was a chiropractic student. It was my first patient. I had never taken care of anybody before. I barely knew how to adjust people. I just had the basic training that I had, which was an excellent training at Sherman College. And within 2 weeks of adjusting this person, again, first patient ever, she was off all her blood pressure medications that she was on for 20 years. So think about that. What were those medications doing to her? What if somebody had told her 20 years ago, get your spine checked or looked at? And maybe she could have avoided that for all that time. And how much was her health changed by getting her body to actually work right rather than be dependent on a medication? So one key thing is make sure your spine is healthy. First of all, you have good healthy spine, a good nerve supply, you'll have the appropriate blood pressure relative to your physiology. Next thing, what did we learn from mummies? What do we learn from mummies relative to blood pressure? Well, in ancient Egypt, they they mummified people when they died, and this it had an incredible preservative effect, obviously. And in examining mummies, they found that when dissecting blood vessels, there was scarring on the blood vessels. Now we know ancient Egyptians ate corn and grain and low-fat or no-fat diets, and we know they had high blood pressure back then because of those diets, because they had scarring on their blood vessels. So what I want you to understand is mummies taught us thousands of years ago, okay, that low-fat, no-fat diets do not work for lowering blood pressure. And you want to be on a good fat diet. The only no fat you want is no trans fats, because those are dangerous. You want to stay away from anything that's partially hydrogenated. Another key thing relative to blood pressure is dehydration. You can have high blood pressure from not having enough water, and your blood gets too thick, and your body purposely is increasing pressure so it can oxygenate areas of your body. And it can be that that's the appropriate pressure. And if you go and take blood pressure medications, you're undoing what your body's intelligently doing for you because you're dehydrated. So make sure you have appropriate hydration. You want half your body weight in ounces. Another key factor is stress. Stress stimulates the sympathetic nerve system. Of course, people can have stimulants in coffees and other beverages like Mountain Dew, and if you're having caffeine or other stimulants, you need to drink 1 cup of water in addition for every stimulant you're drinking, every ounces of stimulant beverage you're drinking. And that ties into stress. Stress stimulates the sympathetic nerve system. It constricts blood vessels. And understand, stress doesn't have to be trauma. Stress can be lack of sleep. It can be a dog barking. It can be balancing your checkbook. Basically things that overload your sympathetic nerve system. It can be handling lots of text messages. One of the signs of stress is bright lights bother your eyes, or if you go from sitting to standing, you have dizziness. Those are signs of adrenal fatigue. Another factor with high blood pressure is people have syndrome X. They're overweight. They have problem getting insulin to cells, usually because they're having bad carbs, pasta, bagels, cookies, and their body's increasing insulin, and then they're having fluid retention through their kidneys. Another thing is atherosclerosis, basically a fat inflamed blood vessels. These are all things that contribute to blood pressure being high, and rather than just taking blindly medications for the rest of your life, you want to do things to strengthen and get your body healthy or well so you live well. Sugar and dairy is another key. There are chemicals in cows in the United States that it won't even sell in Europe, okay? Cholesterol goes up from people trying to stop inflammation. You want to stay away from cheese and dairy and red meat, and to lower your cholesterol. 12 to 14 billion is spent on cholesterol meds. So understand it's a big factor in your economy. And what you want to do with lowering cholesterol, because it affects the blood pressure, is get rid of sugar and dairy. Fast food sodium is another one. People don't realize how much sodium they have in fast food. Fast food burger can contribute 1,200 milligrams in sodium in one burger, and you'll have that experience if you've been getting toxic sodium, because your rings on your fingers the next day won't move around because you'll have swelling. So you want to watch that your body's not retaining water from having fast food sodium. You want to look at the sodium count in foods when you eat out. Medication side effects, I mentioned about having a weakened heart muscle from statin because you're not getting CoQ10. Another key thing is if you're craving lots of sugar is you could be having not enough minerals. You can do hair analysis to look into that. Another key thing that will help strengthen heart muscle is a supplement called Cataplex B, and you want to have enough B vitamins. Exercise is a key factor for lowering your blood pressure. You need to keep exercising. It generally takes 1 to 3 months for the effects of exercise to show up on your blood pressure. And those benefits will only last as you continue to exercise. So you want to make exercise a part of your daily healthy lifestyle for the rest of your life. Flexibility and strengthening exercises such as lifting and weights are important as an overall fitness program. However, really aerobic exercise and interval training, are the things that are going to strengthen your heart and help with blood pressure.